Good afternoon and welcome to another episode of the Health Show here on the ShuraTV in Southern California. My name is Dr. Zachariah and I'm here with you to discuss different topics. We encourage you to comment and like our videos, and also I encourage you to comment and let us know what you'd like us to cover in terms of different health topics that you're interested in so that we can give you more information for it. This week we're in the middle of summer, and fortunately the numbers of COVID cases have increased, and again I caution you and I want to let you know that there are people getting COVID still. COVID still exists, so please be cautious when you go to crowded environments and places that are indoors and you don't know people. It might be a good idea to mask up so that you don't ruin your summer with getting another 10 to 12 days of illness. Also, the World Health Department or World Health Organization has announced that monkeypox is now an official emergency, and they've seen it prevalent in multiple continents as well as here in the US and many states. So again, with that as well, we have a vaccine for that, and if you do have those symptoms or signs, then discuss it with your primary care doctor so that they can get you that simple basic vaccine so you're protected. Other than that, today we wanted to discuss a little bit about mental health, and specifically we want to discuss depression and these affective disorders which are very prevalent in society here. We have over 3 million sufferers of depression across the US yearly, and we get new diagnoses across the board in terms of age, middle age, young age, as well as elderly as well. And we wanted to discuss this and see exactly what to look for, and if you have friends or colleagues or classmates or family members that suffer from these things, we want to make sure that you recognize the signs and symptoms so that you can get these people help. It's very important to get these people help. And of course, we always discuss how to cope with stress on this program, and it's important to have that capacity. But sometimes, the stressors in life get to a point where, one can't handle it themselves with their meditation and with their different types of treatments that they have at home. So it's important to discuss that with your primary care physician or a therapist or a counselor or someone that you trust, so that they can provide you a resource that you can get further help and not let it get worse. Because what happens is with these stressors that you let kind of linger on and without kind of nipping in the bud, it's important to realize that if you let things linger, they become chronic stressors on you. And these chronic stressors are one aspect or one stimulus for depression. They can cause depression. They can be one of your symptoms for depression, because as these stressors are continued in your life and you don't resolve them, there's no resolution, and it continues, then these things can affect your mood and affect your being and your mental state in a chronic way. And that's what we don't want, These things typically will manifest in a way where if you see a person that is consistently and persistently sad, this is something where, normal people get sad and then they recover from it and they go back to their normal activities of daily living. But if you see someone that's always, when you think about them and you're always thinking of them and they're always in a sad state or they're in a somber state, that's something to worry about, because that's not the normal human state. The normal human state is, yes, you get sad about something, you get down, but then you come back up. If they're not coming back up out of that sadness, then that's something to possibly worry about. With that, you'll see also loss of interest in normal activities. So this person will tend to have that persistent sadness, but with that you might see that they lose interest in normal activities in life where they're used to do it and they had fun and they were normally functioning, visiting family, visiting friends, going out, doing their hobbies, biking, running, going to the gym, even shopping. They would go shopping regularly and things like that. But if you see that now they're abstaining from those things, and you see that they're in a kind of a down and sad state, that's something to worry about. The other thing to look for typically is sleeping disturbances or less sleep. If these people get less sleep and you notice that they have loss of interest in normal activities and they're consistently sad and down about things, that's something to worry about. Other things that to look out for are appetite and weight change, appetite loss or appetite gain, and weight changes. If you have drastic changes in those things, that's something to be worried about as well. So these things are things that you can look for and make sure that this person doesn't suffer from depression, or offer them a lifeline. Tell them, hey, I see that you're not doing this, or you're staying home a lot, or you're not enjoying your normal activities. Come on, let's go do something together. Talk to them and see what's going on. You also will see decreased energy and fatigue. Decreased energy and fatigue is another thing to look for. This is something where you'll see in people who are down and depressed. And also lack of focus and thinking quickly. This also decreases with people who are depressed. You'll see that they're kind of distraught in terms of their thinking patterns. The worst scenario, obviously, is if you ask them that they've thought about hurting themselves, or even to the extent of, oh, I don't want to live anymore, or oh, there's nothing to live for, and I'm sort of, I'm mad at the world, and they contemplate hurting themselves, or even committing suicide. That's the worst thing, and that's an emergency, and you need to get help right away. The other thing is if they have chronic aches and pains. With these other symptoms together, if this person has chronic aches and pains, and irritability, frustration, a lot of pessimism all the time, these are telltale signs and symptoms of depression. So what do we do when we see this? You see this in a person, you see these signs and symptoms, and the best thing you can do is talk to the person if they're open to talking to them, and then offering them a resource so they can go and get help. A quick resource would be, hey, why don't you make an appointment with your doctor? Go in and see why your energy is low. You might have a hormonal deficiency or something like that. Just get them to go see a professional so that intervention can start happening. That's very, very important. Typically, what happens is if these people don't get treated, it's like a negative spiral. It gets worse and worse and worse, and you get to the point where they need massive intervention. We'll discuss some different complementary treatments, but obviously, if you go to the physician, they'll take a good history and physical, and they'll discuss with you, what's going on, and then they'll refer you either to a psychologist or to a psychiatrist. And a psychiatrist is just a doctor who studies the mind and deals with the depression, schizophrenia, anything that's of the pathologies that are mind altering. So that's important to have in mind. And I think when these people have these depressive disorders or flare-ups, someone has to be there for them. That's the most important thing. If they have a good network, or if they have a friend to talk to, or if you're that friend that talks to them, or if you notice someone like that, a colleague, a family member, then I think it would be very, very generous of you to proactively approach them and say, hey, I see that you have pain, or you have your energy is low, you don't want to do things. Let's go do something. Let's go out, have a coffee, talk with them, and then recommend that they go and see someone so that they can get help. Typically here, you'll see the doctor, and the doctor will assess and see whether cognitive behavior therapy, counseling, therapy or medical therapeutics are necessary for intervention in terms of the depression. If someone's clinically depressed and the severity is assessed, then you might be also given some what's known as mood stabilizers, some medication, some pills to take so that your mood is stabilized. You never know in terms of what's going on in the brain, whether it's a neurotransmitter deficiency or a malfunction or too much or too little. These things will be assessed by your doctor. And once these things are assessed and determined, then they can come up with a good treatment plan for you. I think it's important to realize that there shouldn't be a taboo, or you shouldn't feel like, oh, I can't talk to anyone if I have these symptoms. Why not? It's just like if you had a laceration on your hand and you need to get attention and get it fixed. It's the same thing. If you have some issue with mental health and you feel depressed and you're consistently feeling depressed, then it's very important for you to get better and get help. There's nothing wrong with that. There's no taboo on that. And nowadays, there's a lot of different resources that you can get for these people, and you can get them back on their way to having a healthy and balanced life. It's very important to do that. There's enough therapists and counselors nowadays that you can schedule and just talk through your problems. And if that does it, that's wonderful. If not, your doctor will prescribe some therapeutics. You take those for a while, see how you do on those. And then there are other complementary treatments that we'll discuss in terms of depression and what to do and what not to do. Sometimes you'll have depression related to also what's known as anxiety disorder. So half of the people that are diagnosed with depression also will have anxiety disorder. We discussed that last week on the program, and I think that's something to be able to differentiate. The doctor will do that once you're with the doctor, but that's something where the triggers are going to be normal stressful events in daily life. So again, coping mechanisms are very important. If you don't cope with the stressors that you have and you don't resolve them, they may turn into things which are chronic stressors on your life, which eventually will take you to a different state and possibly depression. So the important thing is to have a mechanism to cope with the stressors in your life. It's very important to have that. Whether you do meditation, whether you do prayer, whether you do counseling, whether you do group therapy and you go to a group and discuss things weekly, it's important to have that outlet. If you have that outlet and you take care of that, then the likelihood of you ending up with a depressive disorder is going to be much, much lower than normal stats in society. So that's something where you need to do regularly, and you need to actively and proactively actually take care of those stressors in your life and come to resolutions. Don't just leave things lingering. That's the problem nowadays. When there's a big issue or a problem, people just want to swipe it under the rug and just leave it there and shelf it. And the problem is that this shelving and that leaving that problem there without resolution will manifest its head in a more chronic situation for you later. So that's important to do. I think in terms of medications, I've read many studies, white papers, where medications that people are on, like Prozac and even some Adderall and these things, it's only efficacious 50% of the time, meaning that there's another 50% where you can do alternative therapies that'll help you. It's very important. So you need to research that and ask your doctor what are some alternative therapies other than medications. That's very important. Typically, what we recommend in terms of cognitive behavioral therapy, exercise, yoga, breathing techniques, meditation, these things all help the body balance itself. So if you have a good balance in terms of your micronutrients in the body, in terms of your vitamins, in terms of your neurotransmitters, if you and your hormones, they're balanced, then you have the best chance of combating any type of depressive disorders. one thing I mentioned was yoga. Yoga along with Tai Chi and massage is very good. What it does physically is it increases your endorphins, your feel-good chemicals in your body, as does jogging and running and exercise. The same thing. If you have a regular exercise routine and you get on that endorphin high, that helps you with depressive disorders and negative stressors. So that's one thing you can do, is get yourself in a regular exercise routine where you're doing it regularly 2-3 times a week, where your body will benefit and you'll feel good. That's one thing. Meditation and relaxation is another. A lot of people have different types of prayer that they do. They have meditation in terms of they chant and they say things and they do things. This is something where it helps the body relieve itself of a lot of stresses. There's been lots of white papers and research done on chanting, where you chant hymns or you say religious things over and over again. In Islamic theology, they call it azkar, where there's things that you repeat repeatedly, and you do it and you relax and you breathe deeply. It has a very, very positive effect on your mental state, and it kind of releases all your stressors. Exercise, we mentioned, again, with yoga, Tai Chi, and massage. Exercise is something, again, with increases the endorphin levels. And the importance of exercise is to do something regularly. Even if it's just a walk out in the park regularly, 2-3 times a week, it's something where you want to do it regularly. If you can do it regularly, your body will adjust and acclimate to that, and then you'll get the full benefits, the optimal benefits. We mentioned nutritional support. It's important that you tell your family doctor, or your once a year when you go for your exam, for him to check all levels of your hormones and vitamins. This is something important. A lot of facilities won't do it unless you ask. But it's something where if you ask for that, you want to make sure that you're not deficient in any micronutrients or any vitamins or any neurotransmitters, and also the hormone levels. Hormone levels are very important to mental health. You have to make sure that your hormone levels are at a balanced level and they're not too much or too little. This is something where as you get older, as you get past 40, it's important to check your hormone levels because they affect all aspects of your life. And one other study that I ran across for complementary therapy for depression is gardening. A lot of people and a lot of studies have shown not only does it extend your lifespan, gardening, but it also helps with mental disorders like depression, as well as anxiety disorder. If you are someone who gardens regularly and takes care of plants and trees and grass, and you have a garden to take care of, that's something which is very beneficial in terms of decreasing your depressive disorders. These are the things that you can focus on. Again, I encourage you to see your doctor. If you know someone that has those symptoms, please sit with them, have coffee, have a tea, discuss things with them, and offer them that lifeline, that resource. And there's many counselors and therapists and doctors and many yoga classes and Tai Chi and massage. You can get all these things to combat the signs and symptoms of these depressive disorders. If you have any further questions or you want more resources, please don't hesitate to contact us. You can comment on the comment section and we'll get back to you and we'll help you achieve a balanced life in terms of depressive disorders. We'll discuss suicide in another program. Suicide is one main result of depressive disorders. Obviously people that are severely depressed, and we'll have that discussion another time. But for today, that's all we have. Hopefully you have a wonderful week and we'll see you again. Thank you.